Welcome to Anti-Aging.
Thank you.
I'm Nadine.
Nice to meet you.
Sandra, please grab a seat.
Thanks.
Just to tell you a little bit about our clinic. Dr. Frame opened this clinic because he believes in preventative health.
Okay.
You're very beautiful, so it's very hard to sort of say, we're going to try and help you look more beautiful.
No, I'm looking forward to discussing and having a consultation. And
Philosophy here is very simple. I'm 50. I want to look like 50. I want to look good for 50. So this is our goal for you as well. Not to necessarily make you look younger, but to be able to help you look the best you can for the age you are.
Yes. Okay.
Okay, so to make things a little easier, what I'm going to do is grab a little picture. I'd like you to have a look at this and tell me what are your main areas of concern.
Well, I'm 39 this year, and I've never had anything done to my face. My forehead, I frown a lot. I have a lot of expression in my face. Just in the last 5 years, I've noticed my fine lines just are getting deeper. I do wear SPF, so I mean, I don't think that helps, you know, and I use a vitamin C.
So we can work with you preventatively.
Yeah, more of a preventative, I guess, is what.
Could you frown for me, please? When you're doing that, what I'm seeing is these muscles are not that strong, but they're moving and they bring it in. Because they're not strong, that's the reason why you don't have permanent vertical lines. However, after you've been frowning, I do see lines along your nose, and I do see little lines that occur around the butterfly part of your face that we can soften.
I just want to have sort of that natural, I know women who've had injectables done here, and they look very natural, and that's what I don't want to look like I'm, you know, have been overdone or anything like that. Just someone, for me, being a first time, it's a little scary, to be honest with you, but I feel comfortable.
It's normal to be afraid.
Yes.
Of course, it's a treatment. There are some small risk factors, which we'll go over. However, the same way as I see you comfortable to put colour in your hair, we've all become comfortable with being able to do treatments to preventatively take care of our face.
Exactly.
What I see here is that you have, this eye is lower and there's a little bit of a droop on that side. So with your neuromodulator, you're able to lift that a little bit because there are muscles in your face. Some of the muscles are pulling down, some muscles pulling up. With an experienced doctor, we can put a neuromodulator in to the muscle that is pulling down, release that muscle, and therefore you get the lift. So that's how the neuromodulator would work in that eye. Can you see?
Yeah, I do feel like I have heavy eyelids sometimes, and I think that's why I always frown, because the lids are heavy.
I also see that you have some permanent lines in there.
Yes.
Those are the static lines. So when your face is totally relaxed, that's the best that neuromodulator can do for you. So I'm looking at just a few units. Frown for us again. Can you bring your eyebrows together? Okay, so they're not particularly strong muscles here. This is where she does all her frowning, is on her nose. So you can see immediately after, squint again, you see these lines that occur there, and they bring in here. So you do all your frowning with the central area as opposed to the upper area between the eyes. Okay, we'll just do a little bit to soften it, and we can put one unit under each eye. So that would give you a really nice, relaxed look, and we'll start with lower numbers and build them up as we need to.
Yes, that would be great. Yeah.
And as we age, the face depletes in volume. So the two areas where you're starting to show some depletion is a little bit in here, which is what makes you look a little bit more tired. And then when you have this line here, this is telling me that the facial tissue is falling off your cheekbone here. And into this area here, creating this little sausage here, which is the reason why we get this line here. So this line is the result, not the cause of the problem. And they start to form, they eventually end up here. So to support the eye as well, we can put volume back in here. That'll give you that sort of opening. It'll also, if you put a little bit of volume in here and here, it will open that loose tissue, which is giving you those lines. So when your cheek lifts up, can you see you get all these little lines here? So if you put a little bit of fill in this area here, it will absorb some of that extra tissue there. And you could put a little bit there and a little bit there, and it would give you that lift. So it would take off the weight
Wait.
from that line.
Okay, yeah.
So then this line doesn't become deep.
Deep.
So preventatively, you could avoid this heavy shadow in there.
Mm-hmm.
You are getting thin in behind here, which is the reason why I lift up your eyebrows. Relax. Why you get these lines here.
Yeah, I've noticed those too have come from.
Yeah, it's because you're getting thin in the temple.
Okay.
So we could put a little bit of fine lines in there, and that'll accommodate your cheek and this and the extra skin here. So this extra skin now has a body to go over it instead of falling forward and landing in the eye.
Okay.
So to stop this crease and the skin dropping forward, we fill the temple, and so you're going to get that nice opening.
Okay.
So that's another option
Sure.
available for you.
Thank you. That sounds
Okay.
great.